Hello students, today we'll be discussing one more topic that is very important topic which will be usually most of the time will be asked as a short note for 5 marks. It may be for a BSc nursing student or for GNM nursing student. The topic, subtopic, a small topic which is called as Lochia. It's not Nokia because many of the students think, oh, what's that Nokia? Is it Nokia? No, absolutely not Nokia. It's not Nokia. It is Lochia. So Lochia, some place even they call it as Lochia. So usually we call it as Lochia. It's one of the important thing, that is Lochia. So what is this Lochia? As we get confused this word where it tallies with. Lochia is nothing but it is a vaginal discharge for the first fortnight after the delivery. We call it as Lochia. This Lochia has originally originated from the word, that is Latin word, that is after childbirth. So Lochia is nothing but it is a vaginal discharge for the first fortnight after delivery. So what do you mean by fortnight here? Fortnight is nothing but the first 2 weeks or for 14 days. We call it as fortnight. So the Lochia stands for 14 days after delivery. And usually the menstruation, every month the girls will get the menstruation once they are mature. That we call it as menstruation, but it is similarly to the menstruation, but here the vaginal bleeding will be for the 14 days, which we call it as vaginal discharge. So that is the term called as Lochia. Moving on to the order and the reaction of the Lochia. So when you are writing a short notes, there should be a content for 5 marks. So you have to organize your answers accordingly. You can write an introduction of Lochia, then you can move on with the meaning of Lochia, and next to the meaning you can write the order and the reaction. So what is the order and what is the reaction? Speaking about the order of Lochia, it is somewhat offensive, like fishy smell. The Lochia smell is like you feel like it is a fishy like smell. And speaking about the reaction of this Lochia, it is alkaline in reaction and tending towards the end it becomes acidic in reaction. So that 2 sentences you can write regarding the order and the reaction of Lochia. Depending upon the variation of the color of Lochia, it has been divided into 3 types. So based on the color of the discharge, they have divided as 3 categories or 3 types, which we call it as Lochia rubra, Lochia serosa and Lochia alba. So when you see the color of this discharge, Lochia rubra, it is red in color, and the Lochia rubra, the red color discharge will be usually there for 1 to 4 days. So this 1 to 4 days we call it as Lochia rubra. So based on the color they have given the name as Lochia rubra. The second one is Lochia serosa. So here when we are seeing about serosa, it is like pale, the discharge will be pale brownish like color, or sometimes they call it as pink color also. The pale brownish or pink color or even yellowish color, we call it as Lochia serosa. So the Lochia serosa, that is stands from 4 to 9 days. 4 to 9 days we call it as Lochia serosa. So the next one is, the last one is Lochia alba. The Lochia alba, which is whitish discharge or a pale white color discharge, we call it as Lochia alba, which is there for 10 to 14 days. So as I said you, this is a 14 days the period where you have a vaginal discharge, we call it as Lochia. So in that there are 3 types: Lochia rubra, Lochia serosa and Lochia alba. The Lochia rubra is red in color, the Lochia serosa is yellowish or pale brownish in color, and Lochia alba is white in color. And the time duration is the Lochia rubra is for 1 to 4 days, and then 5th day to 9th day we call it as Lochia serosa, and from 10th day to 14th day we call it as Lochia alba. So these are the 3 types where they have described based on the color, they have described this Lochia. As I've said you, there are 3 types of Lochia, that is Lochia rubra, Lochia serosa, Lochia alba. Let's see the composition of all these 3 types of Lochia. First, we'll see about the Lochia rubra. What does it consist of? So, the Lochia rubra consists of blood, shreds of fetal membranes and decidua, vernix gaseosa, lanugo and meconium. So, these are the composite of Lochia rubra. Lochia serosa. So, it consists of less RBC but more leukocytes, wound exudate, mucus from the cervix and microorganisms like anaerobic, that is streptococci and staphylococcus. The presence of bacteria is not pathogenomic unless associated with clinical signs of sepsis. Last one is Lochia alba. What does it contains? The Lochia alba contains plenty of decidual cells, leukocytes, mucus, cholesterol crystals, fatty and granular epithelial cells and microorganisms. So these are the composition of Lochia. Lochia rubra, Lochia serosa and Lochia alba. Next, we'll see about the amount of Lochia. The average amount of Lochia or the vaginal discharge for the first 5 to 6 days, that is almost to a week, is estimated to be 250 ml. And one more thing is, you have to check if the mother has an excessive Lochia, then you have to make sure that how much bleeding, whether she is having an excessive bleeding or what. So you have to provide her with the clean pad, and it should be applied and it has to be checked within 15 minutes to assess the amount of bleeding. And the number of the perineal pads applied during a given period should be counted, or the pad should be weighed to help to determine the amount of vaginal discharge. So if the pad is given, usually you have to count how many pads she has saturated, whether she is having a heavy bleeding. That is the most important thing which has to be considered and noted for. So how you are going to check? So because it is you either you have to count the number of pads, as well as with this pad you have to see the pad saturated level, and then you have to weigh the pad. So when you weigh the pad, the weight of the pad is said that 1 ml of blood is equal to 1 gram. So if the pad weighs like 50 grams, then it indicates that is a 50 ml of bleeding is there. If weighs 10 grams, then it is 10 ml of bleeding. So that so like that you have to weigh the sanitary pad which has been used by the patient to assess the amount of bleeding. So 1 gram is equal to 1 ml. So that's the way how you're measuring the amount of bleeding. And one more thing how you can assess the bleeding is like you have to check the amount of Lochia in the following terms, which are commonly described with the approximate size of the area soiled in 1 hour period. So in 1 hour, what is the size of the pad which has been saturated, that is in the sanitary pad. Less than a 1 inch stain on a perineal pad indicates a scanty bleeding, a very scant bleeding which is less than 1 inch. And smaller than a 4-inch stain indicates a slight amount of bleeding. Smaller than 6-inch stain indicate a moderate amount of bleeding. Larger than a 6-inch stain indicates a heavy bleeding. And pad which has been saturated within 15 minutes indicates the patient is having an excessive bleeding. So this is the way how you are assessing the amount of bleeding. This is usually you have to assess in 1 hour period how the bleeding is. So that is how you are going to assess the amount of bleeding. The duration of Lochia, the normal duration may extend up to 3 weeks. So as I've said you, the duration is for 14 days. That is almost for 2 weeks, and sometimes the duration may extend for 3 weeks. Especially the red Lochia may persist for longer duration in some patients, those who are getting up from the bed for the first time in the later period. So actually we usually ambulate the patient, especially even though if they have undergone a cesarean section, we try to ambulate the patient as early as possible. And for normal delivery patients, we try to ambulate them very soon as they have finished with their 4th stage of labor. So that has to be kept into consideration. And The discharge may be scanty, especially following the premature labor and cesarean birth, or it may be excessive in case of twin delivery or hydramniosis, as some of the studies has been noted. So, this is regarding the normal duration of lochia. Lochia, the lochia is a very important topic, as I said you, based on the theoretical aspects. It is usually asked questions for 5 marks, as I said you, for short note. But beyond that, you can see that the lochia is a very important thing, where it takes the clinical importance also. In clinical areas, when you're working, you have to check the vaginal discharge, that is the lochia. We commonly call it as lochia. You have to check it. So it plays a important role in the clinical aspect on your daily assessment in the postnatal ward. Immediately after the delivery, of course, you are going to check the level of bleeding. That's why they have put that stage 4. The fourth stage is after the placenta is expelled. You're observing the lady, that is after delivery, for 1 hour, or even to 1 to 2 hours. You can observe the lady normally for 1 hour until she voids, and then she has been she'll be transferred to the postnatal ward. So they have added as a 4th stage for observation. So here also you are going to check the bleeding level before, as soon as the lady is delivered. And the next day onwards also, when she is in the postnatal ward, it's a routine work of a nurses to do a postnatal assessment, and you have to check the amount of lochia. So you have to check in her sanitary pad how is the lochia. Mainly it is focused on the amount of lochia, the color of the lochia, and also you have to explain to the lady the duration of lochia. So when you are seeing about the color of the lochia, it should be if it is the red color, as I said you, the lochia rubra, the red color is extending for more than 4 to 5 days, as it is said. But if it is extending those days, then you have to take it into consideration, and thinking that there may be some infections, or there are certain related conditions after the delivery. So you have to check it out if the color is if the lochia rubra, the stage is extending, as well as even if there is a lochia alba. As I've said you, it has to get over by the 14th day. But if you see this lochia alba is extending more than 3 weeks, as I said you, 14 days, but still you are having the vaginal discharge of lochia alba extending more than 3 weeks, then that also has to be considered, and doctor has to be consulted to find out whether there are any genital lesions or genital infections. Those things has to be ruled out. And also regarding the smell, you have to check the smell whether it is as I said you, it is a fishy odor, but still if it is very bad smell or offensive odor, then you have to take it into a note that there may be certain infection. And also the amount of lochia, if it is very scanty also, you have to take it into consideration. And if it is bleeding heavy, if there is if the vaginal discharge is more, then also you have to take it into consideration and bring it into the notice of the doctor for further treatment and investigations. Sometimes if the bleeding is very scanty, then it indicates that is lochiometra, which indicates that there is scanty bleeding, means all this the discharge has been accumulated in the uterus and takes the different shape of the uterus. So that can also, which is the condition is called as lochiometra, that also can be seen here. And if it is heavy discharge also, it has to be noticed. So these are the certain things which has to be considered in the clinical aspect by doing a daily assessment, that is the postnatal assessment. Based on that, you have to take it into consideration, document it at a proper time, and make sure that you inform your ward in charge, or make sure you inform the doctor, so that they can see the patient then and there itself, and the treatment can be given right ahead of it. So that is the thing has to be considered as a clinical importance. So we have come to the end of this topic, a very small topic, that is lochia, Lochia. When you hear this word, you just find difficult to tally what it may be. Lochia is nothing but it is derived from a Latin word, and it is a vaginal discharge after delivery. For 14 days we call it as Lochia. I hope this video will be informative for you, and if you find if you have any questions in related to this topic, you can put it in the comment section. Thank you.